Hi there and welcome to my Rehab Blog. My patient Liam is a 57-year-old male who is usually pretty active for his age. He's complaining of pain and stiffness in his right knee, especially in the anterior portion. This was most likely due to an increase in volume and intensity in the forms of running and walking since the start of the second lockdown a few weeks ago. So having carried out my subjective assessment, I've established there could be a number of issues. Additionally, due to his gait being affected, his left hip area is tight and painful, which is another issue we're going to have to address in the rehab program.
This first clip is me carrying out his gait assessment, which I noticed he was taking quite conservative steps, as well as he was loading more onto his left side. So secondly, I'm just carrying out a quick posture assessment of the lower limb. I'm just checking at the joint line for any inflammation or swelling and the posture of his feet and his knees. I do it laterally, anteriorly and posteriorly so I get a good overall picture. Here are some clips of me carrying out the active and passive ranges of movement. Apologies for the sofa, was the best I could do. So that meant for the knee, I decided to get the patient lying on his front to do knee flexion and lying on his back for knee extension compared to sitting upright on a chair. So here's a clip of the patient carrying out active knee extension on both legs, and I would ask if there was any pain, which there was not. So here's me testing the joint above the knee, which is the hip. I'm doing some hip flexion passively, just feeling for end feel and any reproduction of the patient's symptoms. Here is active hip extension, me just seeing whether the movement brings about any of the patient's symptoms, which it did not, as well as the range and quality of the movement, making sure the pelvis doesn't come off from the sofa. As you can see here, I'm just holding down the PSIS to make sure there's no compensation for the movement. So I also thought it'd be important to test the hip range of motion both internally and externally, as during this subjective assessment he was complaining of tight hip muscles, so I could definitely distinguish increased tightness in the left hip compared to the right, so it's something we need to work on. So here I am just performing some resisted muscle tests on his hamstrings and his quads, again in the prone position. I would score both of these movements on both limbs 5 on the Oxford scale, as there was no issue and he was sufficiently strong. Lastly, I carried out the Clark's test, which tests for patellofemoral pain syndrome. I would class the patient as having a positive finding because when contracting his right quad there was slight apprehension compared to his left side.
As I believe my patient is highly sensitive, I explained to him that the overall loads had to be reduced, as well as to be cautious of doing any aggravating activities. I explained that if he was feeling any discomfort or pain, he should apply an ice pack or some frozen peas over the knee for 10 to 15 minutes, and then to take it off for 5 minutes, and then repeat that process 2 or 3 times. This is because ice would have an analgesic effect and it would help control the flare-ups post-exercise. I also decided to take a hands-on approach by doing some soft tissue work, which would help to increase range of movement and mobility around the knee and the hip. So some clips of my massage will be shown now. straighten your leg. Nice and slow. And back down again. And straighten your leg. All the way. Any pain?
No, it's okay.
Yeah. And one more time. Any pain?
No, it's all good.
I needed to ensure exercises would help to increase hip and quadricep strength, as well as incorporating both open and closed kinetic chain exercises and proprioception.
The glutes and the hip muscles. So you just lie down on the mat, one leg bent, and the other leg, you just put the ankle over the knee, and you feel a little stretch in the right glutes area. To stretch it a bit more, you can just pull your leg in a bit closer. Okay. Yeah. Bring this heel in a bit closer. Yeah. You feel a bit of a stretch?
Yes.
Yeah.
And hold.
Hold it for a few seconds, yeah. So the first exercise, you're just going to be stood here and you want to do a forward lunge with your right foot, just to that little point ahead of you. And just lunge down into it and keep nice control. And then go out diagonally at 45 degrees and step down. And then to 90 degrees, up to the side, step. Okay, so if you want to give it a go.
Okay.
Nice. And back again. Have your hands on your hips. Yeah. And now to this one. Nice. Back again. Try and stay a bit more upright in your body when you do it. And now to the side. Step in. Yeah. Nice. Just out in front. Okay, and back. When you go out to the side next time, step out, accept the load, and push off again back to the start. Okay? Step down and push again. Nice. Same again, just out to the side. Accept it, push. It's goblet squats. So I want you to stand about shoulder width apart with a kettlebell in your grip like this. Keep your elbows nice and tucked in tight.
Yeah.
And then squat down, keeping your chest up as far down as possible without there being any pain. And up again. And squeeze your glutes at the top. Down, nice and slow. And up again, yeah. So we'll do about 15 reps for 2 or 3 sets.
Okay.
There you go. Okay. And up again. So just open your stance a little bit more. Perfect. And go control it on the way down nice and slowly. Yeah. Keep the elbows tucked in a bit tighter. Perfect. And also try and keep your chest upright a bit more when you go down, yeah? Perfect. Okay, so for the second set, I'm going to give you this dumbbell. It weighs a little bit more, but just try your best. So here you go.
Okay.
Right, perfect. Nice and slow. Perfect. Just keep your elbows tucked in a little bit. Nice and slow, chest up, and up again. Yeah. A little bit quicker, increase the tempo a little bit. That's it. Keep it going. So the next exercise we're going to be doing are hip clams. We're going to work on the muscles around the bum and the hip. So you're going to be lying on your side, posted on your elbow. Keep your ankles together, and you want to open the clam. So bring your knees apart. And you're going to feel like your hip and your glutes contracting at the top of the movement, and down again. Nice and slow. There you go. So do about 12 to 15 reps of those. Nice. All the way up, as high as you can go. That's it. Nice. Just squeeze it there. Perfect. You're doing good. Perfect. Hold it and down. Good form. Perfect. Try and keep your shoulder up a little bit. Yeah. Perfect. So this next exercise you can do at home. They're called ice skaters, and they're going to work on your balance, your hips, your quads. So to start with, you want one foot on one line, and all you want to do is jump from this foot, this leg, onto this leg, laterally. And you want to stick the landing and push off. Stick the landing and push off, and hold it for a second. And make sure your arms get involved as well. Perfect. If you're finding it a bit difficult with your hands, you can have them out in front of you like this if it's a bit easier, and just go across.
Okay.
Yeah. Yeah. Push off, land. And when you go down into it, bend your knee a bit. So. Yeah, perfect. Yeah. I prescribed my patient with 2 stretches targeting the quadriceps, glutes and the TFL. This is to be performed both prior to a session as well as in his own time. So over a period of time, through carrying out these stretches, it will help increase flexibility at the hip and the knee. I decided to use graded exposure exercises in the form of forward and lateral lunge patterns, which would help to get the patient familiar with loading through the knee, in addition to addressing probable suspects, including lack of ankle mobility, as the lunge patterns will help force the ankle into dorsiflexion. Additionally, low-weighted goblet squats are a good introduction to knee-dominant loading patterns. By setting high reps, it will help to build muscular endurance in the muscles acting on the knee. Clams are an effective exercise to isolate the hip strength, which will help to prevent pronation of the foot when running. Lastly, a home exercise I prescribe to my client were ice skaters, as they would provide a proprioceptive aspect to the rehab program. Studies show that those suffering with patellofemoral pain syndrome have decreased proprioception at the knee. My client has reported that his symptoms are less prevalent and are not interfering with his day-to-day life after the first few sessions, which is positive to hear. However, upon reflection, next time I would alter a few things. Firstly, I missed out on carrying out some functional tasks during the objective assessment. By doing this, it would have provided me with more of an insight into what movement patterns are affecting him, in turn allowing me to alter the exercises prescribed to him. Secondly, in hindsight, the ice skater movement may have been too complex for my patient, which I noticed when he was performing the exercise. Going forward, I'll either regress or change the exercise to ensure he's not compensating form, which could exacerbate the current injury or cause another one. So that concludes my video blog, and I hope you enjoyed it. Thank you.